We have another thing here from Alexandra from LinkedIn. How does Spring Health plan on combating the fear that employees may have? Let me pull this up on the screen. It's pretty long. The fear that employees may have been seeking mental health insurance through their employers due to the historical stigma surrounding this subject matter. So it looks like now that, I guess you could probably answer this better on from your company's perspective, but what are your thoughts on that?
Well, first and foremost, I am really optimistic about the stigma slowly starting to go away around mental health issues. We as a society have turned a corner, and coronavirus is really accelerating the end to the stigma around mental health, in my opinion. People are talking about mental health issues way more. People even open up on LinkedIn. So I'm really optimistic about it. There are a few ways that we combat this fear of being stigmatized. The first is that we really encourage our customers to use Spring Health or use the purchase of Spring Health to start the conversation around mental health in their workplace. And the best way to do that is to engage your leaders at the company. So there's nothing more powerful than having your CEO stand up at a town hall and share their story, share their family member's story, and talk about how mental health has impacted them. And there's nothing more powerful than having that leader show the rest of the company that it's okay to not only to experience these issues, but B, also to open them up about these issues. And so that's one thing that we do a lot with companies. The second thing that is really important to note is that we're 100% confidential. So none of the data that you share with Spring Health, even the fact that you signed up, ever goes back to the employer. It is 100% confidential. It's 100% HIPAA compliant. We uphold the highest security standards there are. And we only report numbers back to the employer in aggregate. So the employer never knows if you signed up, and we'd never share that information with them.
It seems like you have a nice dashboard too on the on your website. It shows kind of interacting with the employees that have Spring Health. So
yeah, absolutely. I can speak to the dashboard, which is actually one of the most valuable things I think about Spring Health. Okay. I posted recently on LinkedIn that a lot of employers don't think that they have real mental health issues in their company, and a lot of employers are shocked when we show them their employee mental health dashboard. Mm-hmm. And they're so shocked to see that it's not just mild stress or depression or anxiety that their employees deal with. It's eating disorders, it's ADHD, it's PTSD, it's substance abuse disorder, it's suicidal ideation. And we break down these conditions for the employers one by one so they can really see how their organization is doing from a mental health perspective. And this really opens up their eyes to the fact that these are invisible diseases. A lot of people don't talk about their issues, but they're there and they're very real.
Yeah, for sure. We have another question here. So it looks like someone is more curious on your interest in the mental health space. I know you touched on it briefly about your personal struggles and then your friends and whatnot.
Yeah,
it looks like maybe you can get into some of the research by Adam, and how you came across it. But I think it's definitely important to hear more about if you want to go deeper into your origin story or your personal story, which I think it'd be great.
Well, I think it's really important to know that I had my own struggles, but I was so blessed and lucky to not have had it that bad. My best friend's story, though, is the one that really inspired me to solve this specific problem of trial and error in psychiatry. So I was sharing a little bit about the story, but in 2012, my best friend was hospitalized for her eating disorder. This came after months and months of her, being in denial that she had any problem at all. And it also came after months and months of her unsuccessfully trying to receive care. So she went through, as I mentioned, 4 different providers and 7 different antidepressants. And I roomed with her at the time. So I got to see, secondhand, very, very closely, the struggle that she was going through. And her experience just led me to think that there's so much just random guessing in mental health care. There's so much trial and error. And it turns out that most patients go through this trial and error process. 70% of the time, care fails on the first try. And so I thought, wow, it's just so random. And I wish that there was a way for us to much more precisely pinpoint what would work for someone from the start. And so, as I mentioned, I had a habit of reading through papers coming out of Yale Psychiatry, and I came across Adams. And I was specifically interested in mental health care because of my best friend's experience and my own. And I wanted to do something that was truly innovative. There were so many different solutions out there that were improving access to care, but they weren't innovating on the care itself. So there were so many solutions that were making therapy much more accessible, or creating text-based therapy, or making it really easy to schedule with a provider online. But no one was really addressing what happens once you're in front of a provider. And so I came across Adam's research, and I reached out to him, and the stars aligned, and we started the company. And your second question, can you explain more on your solution? We started the company with the foundation of Adam's research and that IP. We got the exclusive license on the IP out of Yale and started building the company. And from day one, our macro strategy was, help patients collect their data and learn as much as possible from their data to help future patients. And so that led us to create an end-to-end solution that gave us a lot of control over the data that we collect on each patient end-to-end. And our vision and our mission is to use that data to become much more precise about what care will work for someone in the future. And so that's what we sell into employers today.
I think it's definitely worth noting. You're talking about pinpointing the exact problem and working with it. And you mentioned on your website reducing the recovery time and the recovery cost. I think that's probably talking about the data and the pinpoint. But I mean, how do you look at how does Spring Health kind of reduce that time and cost?
Yeah, so in a few ways. So for our employers, they often want to do right by their employees, and they purchase Spring Health because they care about their employees and they want them to stay engaged. They want them to thrive. They want to take care of their own, and they know that burnout is real, and just they're looking for something to help with that. But also they're looking at Spring Health as a financial investment, right? So we can help employers quantify just how many lost productivity days that are attributed to mental health issues today in their organization through our platform. We can quantify that value, and then over time, we can show how we've impacted that number, and we can show how many days we have recovered for the employer in productivity among their employees. And so they're looking for productivity gains because people with mental health issues are likely to call in sick, and there's very high absenteeism and even presenteeism among people with mental health issues. But also we can help employers save on hard costs. So someone with a behavioral health issue, especially if the employer is self-insured, which means if the employer bears the financial risk of the healthcare of their employees and pay for the healthcare of their employees instead of paying a premium to an insurance company like Aetna or Optum, if they bear the financial risk of the healthcare of their employees, then they pay for all the healthcare of their employees. And someone with a behavioral health issue is much more expensive than someone without. And so by helping address these mental health issues that the employees are dealing with, we can start to curb the overall healthcare spend per employee. So there are hard healthcare savings to be had from Spring Health.